any bill introductions this morning? All right, seeing none, we'll go ahead and move on to the major items on the agenda for this morning. And so I will turn it over to Chairman Carpenter, the chair of the Social Services Budget Committee, to talk about the budgets for the state hospitals for mental health and the state hospitals for intellectual disabilities. Chairman Carpenter.
Very good. Thank you, Mr. Chairman. Committee, good morning. Hope you all had a great weekend, and we're ready to go after it, aren't we? Okay, we'll be on page, volume 2, page 1218. Volume 2, 1218. We'll start off with the mental hospitals. The state institutions for mental health institutions serve individuals diagnosed with severe and persistent mental illnesses who require inpatient treatment. There are 2 mental health institutions operated by the state of Kansas, Osawatomy State Hospital and Leonard State Hospital. Both facilities are state agencies administered by the Department of Aging and Disability Services pursuant to KSA 39-1904. The agency requests a revised estimate of $134.3 million, including $110 million SGF for expenditures for 2022. For Leonard State Hospital, the revised estimate is $86,600,000, including $75 million SGF, while Osawatomy State Hospital, the revised estimate is $47.7 million, including $34.8 million SGF. Overall, the expenditures increased by $17.1 million or 14.6% above the amount approved by the 21 Legislature. Significant items in the revised estimate include funding for the costs at Leonard State Hospital. Several supplemental requests pertain to the additional costs associated with staffing coverages and food service at the hospital. In part, its revised estimate, Leonard included requests for $13 million SGF for anticipated contractual service expenditures to ensure adequate coverage at the hospital. As the agency has historically indicated, it continues to rely on contractual staff, and has found that the COVID-19 pandemic has created more need for these services. Additionally, the estimate includes an increase associated with Leonard's food service contract. The agency relied on a third party to provide meals for its patients and received a revised estimate for the contract, which increased 62%, which would result in a total increase of $15 million SGF for operational costs for 2022. Shift of category expenditures for OSH. Overall, OSH's revised estimate does not increase significantly. However, there are $2.4 million swap between salaries and wage expenditures and contractual services. As with Leonard, OSH relies on contractual nurse staffing to provide direct support coverage for the hospital when there are shortage of FTE positions. The agency revised its budget to include additional funding for contractual service staff as it anticipates the increased vacancy rate in 2022. This does not result in an overall expenditure increase for OSH in 2022 because of decreases in certain categories of expenditures. The agency estimate includes 1,425 FTE positions, which is a decrease of 4 FTE positions below the number approved by the 2021 Legislature. The governor recommends $120.1 million, including $95.8 million SGF for expenditures for 2022. This is a decrease of $14 million and $2 SGF below the agency's 2020 revised estimate. Decreases for the recommendation are primarily related to the governor not including several of the agency's supplemental requests as following. Operational costs at Leonard State Hospital, the governor does not include the additional $13 million SGF for Leonard to fund additional contractual staff, nursing staff. Additionally, subsequent to its budget submission, Leonard revised its food contract estimate to $893,000 SGF. As such, the government recommendations adopts this new estimate for Leonard's anticipated increase for its food service contract. This would result in a total decrease of $13.5 million below the SGF below the Leonard's revised estimate for 22. Sexual Predator Treatment Program, Safety and Security. The governor does not recommend Leonard's request of $552,241 for safety and security FTE positions at the SPTP program. This request was originally to fund these positions for half of 22 and into 23. However, the governor's recommendation does not include the funding for 2022. It does include partial funding in 2023. This would result in a total decrease of $552,241 SGF and 18 FTE positions below Leonard's revised estimate. Micah House reappropriation. The governor's recommendation does not include an additional $53,000, which was inadvertently lapsed from the appropriation for SPTP reintegration program. This would result in a total decrease of $53,749 SGF below the OSHA's revised estimate. The recommendation also includes 1,407 FTE, which is a decrease of 18 FTE positions below the agency's 2020 revised numbers. The decrease is due to the governor not recommending Leonard's supplemental request for additional safety and security positions for FY 2022. The House Budget Committee concurs with the governor's recommendations for 2022, and I'll stand for questions.
All right, thank you, Chairman Carpenter. First question I have in regards to Leonard State Hospital is how many approved FTEs do they have, and then how many are vacant?
I forgot my sheet. Sorry, Mr. Chairman, we had it on that sheet yesterday, the other day when they reported to us. I'll get it here in just a moment.
All right, thank you.
So, Leonard, is that your question was Leonard?
Yes.
Their authorized positions are 909.
909, how many are vacant?
That's, that was what, can I, Scott, do you have that number, please?
Well, normally,
Okay.
well,
Let me find out then. How many are vacant, Matt? I had that sheet and
Approximate amount for.
Oh, here, the approximate vacancy amount is 385
And that's just Leonard.
at Leonard
All right.
and 184 at Osh.
Okay. And I know that this has been reported in the media, and it seems like it's been happening recently, and we're talking about the safety and security at Leonard State Hospital, and there's been some escapees, I guess is the best way to put it. So I'm just kind of wondering what the discussion was in committee and agreeing with the governor's recommendation and not funding the additional amount for safety and security.
I think you'll see some of that discussion will be in 2023.
Okay.
This is 2022. So we did have some discussion on that in 2023, but not for 2022.
All right, we'll wait for the next fiscal year. Committee, any questions for Chairman Carpenter in regards to the state hospitals for fiscal year 2022? Representative Williams.
Thank you, Mr. Chairman. So can you also provide us a little context? What's the occupancy rate for Leonard compared to Osawatomy, and just a real brief distinction of services?
Chairman Carpenter.
Good question. That I cannot tell you. I will be glad to find out. I just might say that we had the conversations about these about a month ago, and I'm on to DCF and KDADS and a whole bunch of other things, and I would be remiss if I didn't explain to you exactly so that I didn't misspeak.
And you have the hardest budget for sure. And I think that Larned is a lot larger than I realized with 909 possible employees compared to 184. And I just didn't realize. And I thought at one time there was a division between the state on where you might go if you needed services, but whether it was Larned or Osawatomy, yet there's a huge difference in size. So I think the services would be vastly different perhaps.
They're a lot different, and I know Larned is involuntary. That's probably been the biggest problem with Larned is have a shortage of involuntary beds. So we've done that.
Program, the three different programs, the sexual predator.
Right.
Any further questions, Representative Williams? Any further questions for Chairman Carpenter on fiscal year 2022? Representative Ballard.
Yeah, clarification. What was that question again that you asked? That's what I wanted to know.
Occupancy rate. So how many beds are full? How many people are they serving?
Right.
That's what I meant.
I can
If
tell
I
you
was
that.
okay, maybe I used the wrong term.
That's what we didn't know. Listen, go ahead.
Yeah, I can tell you that. I just can't tell you the level of services that, actually, I've been asking for that for several weeks, and I think I'll get that information here. But it's a larger discussion we'll have in the KDAD's budget, but it goes to what beds we have, what the level of care is required, and how many we have around the state. That's more of a global discussion, but I've been asking for that information for several weeks so that we can really understand what PRTFs are, crisis intervention beds are, all that kind of stuff. And I've been asking it in a language that a layperson like myself can understand. So anyway, but back to your question, the budgeted beds at Osawatomy are 114, and at Adair, which is another part of Osawatomy, the acute care, which is involuntary, it's 32, or is it 60? It's 60.
Yeah, budgeted, and that's the average.
Okay, it's 60 there, and at Larned, the Psychiatric Services Program, PSP, is 90 budgeted beds. At Larned State Hospital, the State Security Program, which is another program, 140 beds. The Sexual Predator Treatment Program, SPTP, 274. And STP Reintegration Unit, the Myers East, which is at Parsons, is 16. And the average census on those, Osawatomy at Osh is 97. The Adair is 32. Larned Psychiatric Services, PSP, is 69. The State Security Program is 88. The Sexual Predator Treatment Program is 245, and the Reintegration Program is 9.
For the committee, I would reference that on page 1239 in your books, there is a diagram that has the census statistics for Leonard State Hospital. And in 1243, there is the same or a similar diagram for Osawatomy that talks about the bed capacity and the emissions and everything. So just, it's all in the budget book.
And I could just,
Representative Ballard.
and I'll just comment. Thank you, Mr. Chairman. It's not that easy to say what it is because there's so many different programs within Larned that we have to deal with. And then Osawatomy, of course, right now, as January, we opened it for voluntary, but that will only happen if the beds are not being used at that point. So it gets very complicated, but you said we can give you the numbers, but you have to ask which particular program are we talking about in relation to that, and the chairman just told you it was a breakdown, so thank you.
Representative Williams.
No, your signing of the page in here is perfect. Thank you.
All right. Any further questions for Chairman Carpenter? Seeing none, you may move on to 2023. Oh, Representative Kincannon.
Thank you, Mr. Chairman. Chairman Carpenter, could you explain just a little bit more about that shift in expenditure? What is this for the contractual, the temporary staffing agencies?
Chairman Carpenter.
Yeah, yes, let me find it here. In 2022.
And
yeah.
I guess a follow-up for that is, are the state hospitals getting better contracts than what we're seeing, what we're having reported to us from the nursing homes and the smaller hospitals?
No, as you heard in testimony here the other day, it's 1 to 5. So we're having one person as a contract person for 5 regular employees, and that's about it. So we're faced with that also.
Okay.
Are you talking about increased contractual services, which is contract nursing? Is that what you're saying?
Representative Buchanan.
Yes, I guess I'm trying to follow the dollars here. So you've shifted it from FTEs to you've got it under a different category. So I'm
Yeah, it just takes it from wages and salaries and puts it into contractual services, which is what we use when we contract nurses or any other employees like that.
Representative Buchanan.
So is it coming out break even? Obviously, it's not coming out break even. So how much more are we spending is, I guess, the bottom line, what I'm trying to get at.
Chairman Carpenter.
I do not have a breakdown of how much more we're spending. It's just that we're shifting it from wages and salaries to contractual services, which is where the money is being used.
Representative Buchanan.
Yeah, I want to clarify that. I don't mean how much more we're spending than last year. I want to know. I'd like to know how much more we're spending than if we had those positions filled, and they were receiving a wage. How much more are we spending to meet the contractual? So,
I kind of understand where you're talking about. If I can find that information, I certainly will. It's kind of a gray area, but I know we're spending a lot.
Okay, thank you. Thank you, Mr. Chair.
Any further questions in regards to fiscal year 2022? Now seeing none, Chairman Carpenter, you may move on to 2023.
For the agencies in 2023, 144.9 million, including 123 million SGF for expenditures for FY23. For Leonard State Hospital, revised estimate is 93.2 million, including 83.8 million SGF, while OSH's request is 51.8 million, including 39.7 million SGF. Overall, the expenditures increased by 10.6 million, or 7.9% above the 2022 revised estimate. Significant items in the agency's request including additional SPTP funding. Leonard requests includes several enhancement requests related to increased services through the Sexual Predator Treatment Program. These requests include funding for additional STP unit as well as funding for additional staff to assist the population growth of the SPTP. Yeah, the hospital has indicated that the SPTP, say that fast a couple of times, population continuing to grow, and that the new participants appear to be increasingly aggressive. As such, the agency would like to increase the SPTP staff and services to account for its increasing population. It would result in a total increase of 6.3 million SGF for the SPTP program for 2023. Additional staff for Leonard PSP program. The request that Leonard submitted include 1.4 million and 17 FTE positions for 2023, and additional staff to the Psychiatric Services Program. The hospital reports it has a wait list of 96 days during 2021. The agency indicates that these positions are necessary to appropriately assess, treat, and supervise and discharge patients. The hospital's goal is in increasing staff is to provide quicker service to individuals civilly committed in an attempt to reduce the wait time. For services at Leonard, this would result in a total increase of 1.4 million SGF to the PSP program in 2023. Moratorium-related increases. The OSH request includes 2 enhancement requests to assist in lifting the moratorium on voluntary admissions. This request primarily relates to the adding FTE positions and funding to staff the Biddle building once the remodel has concluded, and the addition of funding dedicated to a social detox program to assist individuals with substance abuse disorders who are admitted to the hospital. This would result in a total increase of 2.4 million SGF from the moratorium-related expenditures for 2023. The agency request also includes 1,572 FTE positions, which is an increase of 147 positions above the 2022 revised estimate amount. This increase is due to the agency's enhancement requests for additional staffing at the hospitals. The governor recommends 124 million, including 103.3 million SGF for 2023 expenditures. This is a decrease of 20.2 million SGF below the agency's 2023 request. Decreases in the governor's recommendation are primarily related to the governor not recommending several agencies' enhancement requests for the following. Leonard State Hospital enhancement request for 2023, or the governor does not include the 13 million for the SGF for Leonard Hospital to fund additional contract nursing staff, nor the agency's enhancement for additional FTE positions for the Psychiatric Services Program. This results in a total decrease of 15 million SGF and 17 FTE positions below Leonard State Hospital's request for 2023. Additional SPTP, the governor recommendations does not include additional funding to expand the SPTP program. Leonard's request includes several enhancements to expand the SPTP program by adding additional SPTP unit as well as adding additional FTE positions to the current units. This would result in a decrease of 6.3 million or 96.6 FTE below the Leonard's request. Significant items in the governor's recommendation that partially offset the decreases discussed above are moratorium-related increases. The governor recommends the adoption of OSHA's 2 enhancement requests to assist in lifting the moratorium for voluntary admissions. These requests were to add FTE positions and funding to staff the Biddle building and the addition of the social detox program to assist individuals with substance abuse disorders who are admitted to the hospital. This would result in an increase of $3,018 SGF due to the technical correction to OSHA's request in 2023. Operational and upgrade costs at Leonard State Hospital. The recommendation adopts several enhancement operational costs and upgrades to the state hospitals. This includes $393,000 for anticipated costs of the food service contract. They originally estimated it to be 1.4, but subsequently in budget submission revised the contract estimate to $893,000. This recommendation also includes Leonard State Hospital's request to upgrade the phone system in the hospital, as well as upgrades and FTA positions for the state security program. This does not result in an increase in expenditures above Leonard State Hospital's 2023 request, but a shift in sources of funding. Salary increases. The recommendation also includes funding associated with the governor's executive directories. 21,537 and 21,538 to increase the salaries for direct care staff in order to assist in staff retention issues. The recommendation includes a total of 1.5 million SGF. Originally, only Leonard was included in the enhancement request to fund the increases. This would result in a total increase of 1.2 million SGF above OSHA's request for 2023. The recommendation also includes 1459 and FTE position, which is a decrease in 113 positions above the agency's 2023 request. The decrease is due to the governor not recommending a majority of Leonard State Hospital's enhancement requests for additional positions for the SPTP and the PSP programs for 2023. And to answer the chairman's questions, I think that what we're looking at here in this phone system is part of an upgrade that they were planning on doing that is in the budget. And the way I understand it is the phones right now, you're not able to, like they have a button that they can push if they're in danger, but they're not able to phone to phone people. And so there's money in there to increase that phone system.
All right, thank you, Chairman Carpenter. Representative Rogers.
Thank you, Mr. Chairman. Okay, walk me down the path of how this reduces the wait list, because I'm seeing reduction in staff. We have so many openings now. What you know, and again, I'm do my best not to be territorial, but my district gets served by Leonard, and what I'm saying here is the enhancements that the governor did not approve. Did not approve. I don't see. I still see a waiting list. I mean, how is it going to be resolved, or it's not?
Well,
Chairman Carpenter.
I think that first we have, here, the whole wait list is just because by staffing issues. It's just that simple. And so we can approve all of these things all we want, but if we can't hire the staff, we can't do away with the wait list. We have significant amounts of capacity right now in that hospital to do away with the wait list. Right now, if we had the staff, there would not be a wait list. And that is why the wage factor is coming into this. Now, I think there's a separate conversation here that we're going to have to think about, and I think you and I have had this conversation about is wages the issue? And I think that we have got to, at some point in time, and when I came to the session this year after putting, we put over the last 17, 18, 19, 20, and 21, we've put over $10 million in wages in these state hospitals. That's not even counting 2022 or 2023. And yet we've not made one different, well, maybe a couple, but we have, as far as I'm concerned, we've made no difference in spending that much money getting their wages up. And in 2023, it's another, in 2022, there's another $10 million worth of wage plans, and there's another $6.9 million in the executive directories that we're talking about, 537, 538, 6.9 million, for a total of $16 million in 2022. And that's federal money, just so we're clear on that. It's for some of the representatives. But at some point in time, it's about staffing. And I am just as appalled that you are about a wait list, but we have guidelines that require a certain amount of staff for anybody that we have in our hospitals. And until we can get that staffing up, we can't have any more people in that hospital. It's just that simple. And I don't know how much more I can embellish on that.
Right. Well, Mr. Chairman, and I think, I guess I bring it up to have a larger conversation sometime, because I agree with you, and not say that you and the committee have done a Herculean effort to try to solve these problems or the challenges. I wouldn't tell them problem, call them challenges but continuing to seemingly to throw dollars at it, we're not getting the staff we need. And so that's where, if it's a deep dive or if it's something else, because I have concerns, reading what came out in the local newspaper, that was kind of delayed, that has grave concerns as well. And so if it's getting a new phone system, that's fine, but I'm trying to find, trying to make sure we have that conversation of doing a deep dive and find out really what the issue is, because again, if we're throwing all these dollars out, we still can't hire staff, then that's
Then it's not just money,
Yep.
if I may finish. And that's what I've come to the conclusion. It's how we treat it. And part of it's just the job. It's 24/7. It's 7 days a week. And then, of course, I'm not telling you anything you don't know, but when you are short-staffed, then you've got folks working 2 shifts, and they have no life at home, and so then they get burned out, and so they quit. It's that revolving door that we've talked about in our prisons, in all of our, especially, I think, in the 24/7 facilities where you're open 7 days a week and you've got a level of care that you have to provide. Everybody that's come in my door this year, I've talked about not just money, but how you treat your employees. Make them feel special. I think Representative Francis talked about it the other day, but sometimes, and this is, I'm kind of digressing here, but when I was had payroll and staff and all that kind of stuff, I went to several seminars to try to how to understand Generation X and the millennials, because they don't think like we do. And I've tasked everybody to think differently about that. And the other part of that is they don't keep jobs as long. It's just a traditional thing with those is if they're a year, so you still spend all this money training and they're still gone. And so it's a huge can of worms. Boy, I wish I had some answers. In our prison systems and some of these, I think, that maybe our staff should, our administrative staff should maybe go, and I'm not, just to school to learn how, maybe to, learn how to deal with staff a little bit easier or differently than they possibly do. It's just multifaceted, and I'll get off my soapbox. I've digressed entirely.
Thank you, Mr. Chairman.
Well, and if I could add some comments to that too in regards to staffing, that's why I posed the question. And I agree with the Budget Committee's recommendation aligning with the governor, which is a decrease of 113 FTE positions because we have a high vacancy already.
Yeah.
And we have to question what is causing that. This committee, for the last few years, has discussed and also approved and basically looking at the pay disparity between the correctional facility and the state hospital at Leonard. Leonard is the only campus throughout the state that has 2 of those functions on the same campus. The correctional facility has been receiving pay increases and the state hospital has not. And there was this pay disparity, and we tried to address that in this committee. We did approve it. In conference, when we go to the Senate, they don't necessarily agree with our position. But it's an issue. When you have one institution on the same campus getting less money for a starting wage, you're going to see a crossover. And that's what's been going on in Leonard. And so we've been talking about having a partnership between Fort Hays State University and Barton County Community College. Some have also suggested that we also bring in Pratt Community College and those institutions that are close to Larned, and working with the community leaders, the city council, the county commissioners, county economic development, the Chamber of Commerce in Larned, and then also discussing the issues in regards to wages and how can we attract those individuals that are graduating from those institutions to look at Larned and the programs that they got their degrees in and working at either Larned State Hospital or Larned Correctional Facility. Now, I do have to say that that conversation hasn't transpired yet, but we have talked with the president of Fort Hays State University and the president of Barton County Community College, and they're in full agreement and having a conversation with the partners of either Pawnee County or the city of Larned. And so we're trying to work on letting individuals know that there are opportunities when they graduate from that particular institution. For those of us that did attend the mental health tour a few years ago, and we went to Larned and toured the facility there, the community of Larned embraces the state hospital, and they want to be an active partner. And if you look at some of the employees that we have at Leonard State Hospital, they're not just from Pawnee County. They're all across the state. They had employees from Johnson and Douglas and Sedgwick. This institution does not just employ individuals around the surrounding area, it's all across the state. It's an issue that we need to address. It's an issue this committee has tried to address. But unfortunately, it's still an issue. I agree with, like I said, I'll say it again, I agree with the Budget Committee's recommendation. If we have a high vacancy rate, why would we increase more FTEs in a particular institution? At the same time, it is something that we are going to have a discussion on, because it's been an issue not only this year, but for many prior years. And it's something that we're going to have to address, not just for Leonard State Hospital, but also for Osawatomy.
It is.
We need to address it system-wide. The 24/7 pay plan has helped.
What's that?
It has helped in regards to the retainment of staffing, especially at Leonard. I mean, I had a conversation with some of those associated with Leonard, and they said it has helped, and it has kind of dispelled that pay disparity between the correctional facility and the state hospital. But again, when that was initially brought forward, it was supposed to be temporary. This is going to be a long-term issue that we're going to have to find some type of resolution for.
Agreed.
Representative Helgerson.
Where do I start? First, Mr. Chairman, you mentioned that you'd asked for statistics and information about where we're at, how many beds we're supposed to have, how many are certified. I asked for the same thing, if you may remember, on Friday. And I got back an email from the department, told me to go back and look at the task force, I think it was 18 and 19, by which they probably didn't know. I'm the one that asked for this on the House floor, if you may remember. These aren't new issues, but we are on, let me mention, the chairman mentioned that these are issues that have been there. In 1990, when mental health was passed, we questioned whether or not we can afford to come up with the staffing in those two facilities. That was a legitimate question at that time, because we said, we don't know if we can recruit enough staff into areas that are away from major population areas and take care of the population. That's why it was recommended that we needed to go to smaller regional beds to take the demand off of the facilities. Now, first thing I'd ask, you haven't gotten any document that says this is where we were when we're decertified, how many beds were in the facility, how many beds they think, how many beds that are certified or going to be certified in the hospitals, and what they expect to be in the future. Have you?
Chairman Carpenter.
Thank you, Mr. Chair. I might clarify. I have received a partial document, but I have not received the full document that when I do, I will release it to this entire committee and anybody else I can hand it to. But I have received somewhat of a count of the types of beds, which some of them are Greek to me, but I haven't received a description that I can also hand out with that paper that tells anybody that's not a psychologist or whatever what those beds actually serve. So I have an inventory of the beds where Matt here is taking a look at them right now and moving it around so that it's in a very easily understandable document. But I did receive those over the weekend. I'm waiting for the actual description of the types of beds. And-
I'm sorry.
Go ahead.
Representative Helgerson.
This is just for the 2 hospitals, correct?
This is statewide. You know, we can't have this conversation about the state hospitals without also knowing about our regional beds that you were talking about, which, quite frankly, I've supported for a number of years, because I think that when you talk about regional beds, they're closer to whoever, you know, if you're talking 60 miles or 100 miles or 120 miles. So I've supported the regional hospital model, and I still support that a lot. And I actually wonder if that isn't something that we need to move more towards what we're talking about versus this Larner. But you can't have a conversation about the state hospitals without talking about our capacity statewide, at least in my limited knowledge.
And I totally agree with you. But that's why I'm asking, first of all, find out what our status is with the 2 hospitals. And then it sounds like you got some information about not only the state hospitals, but the regional hospitals.
Correct.
But that raises the whole question. I think the document we received last week said that we're going to get a $29.3 million increase in mental health services for these facilities, I think for in part or in all. In Sedgwick County, there's going to be a 50-bed. And in looking back at the task force, the task force specifically says that these may be new regional beds or state hospital beds. Well, are we having a new hospitals? You know, we're being asked right now to approve, I don't know, what is it? Hundreds of millions of dollars for state hospitals. And I don't know if we're going to have new hospitals somewhere else or a series of regional hospitals and how they're all fitting in.
Mr. Chairman.
Chairman Carpenter.
And I appreciate those questions. I think that was what triggered, and this budget is a small part of what the next budget that I'm working on, which is why I wasn't very prepared today on this one, because I'm already on KDADS, which includes that hospital and a lot of the stuff that we're talking about. So I think that when I saw that, that was the first thing that I thought, you can't build a new hospital without a complete inventory of the beds that you have and also of the future needs. So I think that this is a global conversation that we're going to have. We're going to have it in the KDADS budget. I applaud you for gathering that up, and I'm gathering information, and I will get it out to the committee as soon as I can to try to have that global conversation about, truthfully, do we need a new hospital is is basically the answer. There's $15 million in the budget to start that process. I can't even recommend that without knowing what we need or what we have now. I mean, it's that point blank. So anyway.
Representative Helgerson.
Well, you're at the same point that I'm at, it sounds like. I don't know how the continuum of care works and how it's going to be funded and how much it's going to cost. Okay. Let me go back to one specific thing, and I'll hold all the other systematic questions that I have, you know, because this is not new information. It's just how it's being plugged in and how much money it's costing. You're going back in in Osawatomy to detox beds, 3 detox beds, I think. Is that right?
Mm-hmm. Correct.
That is a policy shift that was made in the 90s that we should not put detox beds at the state hospitals. You know, and the reason was because we ended up taking a lot of hospital detox beds into hospital. They should have been somewhere else. What information did you receive with regards to that?
Chairman Carpenter.
Thank you, Mr. Chair. I did not receive any information according to that, and I'm happy to say I wasn't here in the 90s.
Yeah. Yeah, some of us were. Okay, I'll hold the rest of the information and the questions.
Representative Wolfmore.
Thank you, Mr. Chair, and I would welcome a larger conversation about this when we get to the KDADS budget, but I guess I'm recalling the Secretary's presentation and Scott Bruner's presentation, and I I think we are expanding the continuum in some ways. We've had the crisis stabilization. Now we're going to have the crisis intervention beds. We have the SIA beds, which are the beds that we contract with various facilities that are already in operation. But in addition to that, they're saying that regional model, which I can't remember, was it 50 beds? And the regional doesn't just expand our capacity, but I think what it does also responds a little bit to Representative Raj's point that he's mentioned a couple times about areas that don't have these resources. So the more, for example, when we built RSI, we stopped sending as many patients to Osawatomy because we could keep them closer to home. With these regional beds in Wichita, that will open up more beds at Leonard so that the rural areas have beds to go to. So the more we build out these resources and we keep the brunt of those people in the bigger cities, then that opens up Osawatomy and Leonard for places like Representative Rogers, who doesn't happen to have all those services built around them. So in my view, it is a continuum, and we're making progress on that. So my 2 cents, and I'll love to talk with you further.
Chairman Carpenter.
I think that's true. But ultimately, if we build out our regional bed, which is taking advantage of our rural hospitals and other things like that, do we need a new facility? And, you know, we just had this conversation, which a huge conversation about the new facility is, can we staff that thing? You know, I mean, truthfully, it's a huge issue. We build a new facility and we can't put 25 people in there because we can't staff it. So, you know, in a separate deal, we have and you'll hear about this in ks, we have a building, 106 beds in Kansas City for PRTF. We could do away with the entire PRTF wait list if we could find staff to staff that building, 160 beds building. You know, so, I mean, it's a global picture, and we've opened up this can of worms, but I think that we have to analyze and we have to know what we have now and what we need into the future before we start to project even a new facility or anything. This staffing's been going on for I don't know how many years, this staffing issue. And I might mention while I've got that, I do have a chart here for 2022. An activity specialist at OSH and is $16.94. Activity therapist, $19.16. Licensed, this is our biggest one. It's a MHT. It's a mental health tech. $18.22. Practical nurse, licensed practical nurse, $20. $16.94. $16.16. These are all at OSH. And then if you go over to Leonard, it's $16.94, $16.94, $19.16. Leonard actually has gotten a couple of raises that the others have not in this process. So that I do have this sheet that if anyone wants to know what that is, I'll be glad to pass it out. Sorry, I've digressed, Mr. Chairman.
Oh, no, it's good to have the conversation. Representative Landwehr.
Thank you, Mr. Chairman, and I think this is something we could probably spend hours on, so I'll try to just hit some highlights here. I guess I would recommend, because I think people get a little bit confused about all of the different types of beds and programs that are involved in mental health. Are you a child? Are you a foster child? Are you an adult? How severe is your issues? So perhaps we need to have KDADs come in and actually give us a flow chart of how the mental health system in Kansas works and all of the different layers that goes with it. You know, Representative Carpenter's right. You know, the talk about beds is not new. The talk about staff is not new. The services in our communities have been reduced and cut. And now we're to a point where, again, the workforce shortage is really hitting everybody. It's one of the reasons the mental health initiative in K-12 has become so important. It's why the CCBHCs, the 988, the crisis units, our clubhouse models that we funded. And I know that members of this committee and other legislators get tired of me talking about mental health, but this is the thing that is costing us millions, if not billions, of dollars in our state budgets as well as businesses across the state. And this legislature has a hard time making the financial commitments. And you can go back through the history, so I'm not just blaming people here in this room or in this legislature of wanting to fund these services. And when the Topeka State closed, and when Winfield closed, and then we lost Miniger, everything started going downhill from them. We're not taking care of people in the community when they need the services up front. When you don't, it's going to escalate, and then you have to fill the beds. There's my soapbox for today. Thank you.
All right, thank you. Representative Ballard.
Thank you. I will say Representative Leonard hit on some areas I really wanted to, because, again, we've worked on this a long time. But I think the chairman also hit on some areas that I thought was extremely important. We have had this problem before COVID. COVID just exacerbated the whole thing in many ways. Wages was a problem. Where we recruited was a problem. How do we get people? And he mentioned they come from Douglas, they come from different places all around. How do we recruit those people when they also had a problem with available housing? So that if they came from a distance, where were they going to stay along those areas? The commute, were they getting paid mileage in order to do all of this? I think all of that really became a problem. The other thing is we have certified beds, which will draw a federal match, and licensed bed, which do not. So in terms of, that's what this whole thing in 2015 was about when we lost that funding from the federal government. So I think it's a problem that everyone has said was there before, but it really is exacerbated now. Also, we have an increase in mental health nationwide. There's also a larger percentage in suicide right now, and we're trying to meet all of those needs at the same time. I don't know where all these people are. I mean, it seems like everywhere you go, there's a sign that says hire, 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 and everything else. I don't know that it's just money or people want to change their professions, but I do know that there is a big problem that we're going to have to address, or we will always have a shortage. Just by where Osawatomy is located, where Leonard is located, and can we accommodate people that come out, or will we have accommodations for families? Because most people don't want to just move by themselves. They would like to have their family with them, and that's creating a real problem. And when we were in Leonard, we went around the neighborhoods to look, and they told us then, and that was 10 years ago, that we were going to have a hard time recruiting people. So I would just add to what my chairman was saying, that it's complicated. We're making headway, but not at the rate that most people want us to. Thank you, Mr. Chairman.
Representative Kincannon.
Thank you, Mr. Chair. I've got two questions that are kind of unrelated to each other. In the conversation about the number of beds and getting an accounting, I would also be interested if there are a number of beds that they plan to close. And, what the intent is. If we can't staff them in Larned, breaks my heart to say it, but, if we're opening 50 beds in Wichita, it might be easier to staff them there. I would certainly hate to see all beds go away in the western part of the state, but I'd like to know if there's an intention there of closing. And then my other question, which would help us with planning, with future planning, when they testified, did they express any problem with I keep harping on the staffing agencies, but they're a huge problem. Did they express a problem with them recruiting the workforce away, recruiting staff that is currently employed at Larned away to their agency.
Chairman Carpenter.
They did, as well as just the fact that they were having to pay 5 to 1 for staffing. But some of our staff has left, you know, like a lot of nurses, like hospitals and all that have left to be a contract nurse. They can make easily double the money and then sometimes work back in the same facility that they were taken from. Or I misspoke. I don't know how you would say that. What would you say? That they were formerly employed with. How's that for being politically correct?
Representative Kekina.
Thank you, Mr. Chair. I'm good.
Representative Owens.
Thank you, Mr. Chairman. I'm really grateful for everybody that is having input on this conversation, because this is huge. This is a very needed conversation. Two things come to mind quickly. First, Leonard was built in 1914. A lot of things have changed in 100 years, as well as our population shifts away from rural Kansas. So you're only ever going to get so many people that want to live in Leonard, Kansas. I love Leonard. It's a great town. Only so many folks want to be there. The other thing that I wanted to mention is the solution lies within our universities. We have proposals from NIAR that are specifically building facilities and addressing money from the state to solve a need in South Central Kansas as it relates to aircraft, right? Manufacturing, creating programs that then create employees. We just last week pulled $160 million out of the state university's budget and says, come back to us and provide us with solutions for economic development. Well, I challenge our universities to address this problem. Bring proposals back to this body that utilize some of that $160 million to solve our problem, finding the employees as it relates to the mental health needs of our state. Thank you, Mr. Chairman.
Representative Helgerson. Representative Landwehr.
Thank you, Mr. Chairman. I think, probably one of the other things in response to what Representative Concanon was talking about, the conversations with the secretary is they're looking all around the state for beds. So if they can find a hospital that can convert 5, 6, 8 beds to handle mental health, that's exactly what she's doing. We do not want to reduce services anywhere in the state. So even if there was a new facility, and we're talking 2, 3, maybe 4 years down the road before you can get a 50-bed hospital anywhere in the state, even if it was in Sedgwick County. I think if the committee would take the time, and I suggest you pull it up online because of the hyperlinks that are attached, and that's the Mental Health Modernization Committee report. It brings together all of the studying that has been done by different organizations, as well as the Mental Health Modernization Committee, and brings them together in one report. And it talks about these kind of things in detail. It gives solutions. And it needs to be more than one person that carries the water from that committee into this legislature. In response with what Representative Owens was talking about, I think that's where the Health Science Center that we heard last week from KU and WSU together is going to be a benefit. But again, it takes time for those programs to get started. There has been and there is discussions across the state with our community colleges on some of this. There's also the discussion on what can we have on maybe entry-level individuals to come in to deal with the health deal. But we've already got the plan is out there, is if we start with that mental health modernization and start picking things in there that we could take and move forward. And that report comes from the people in the field. It is only guided by the legislatures. But those are the people that are out there actually doing the work. And this last year, we added judges to that list. And it's an eye-opening report if this committee will take the time to look at it if we truly want to solve this issue. Thank you.
Representative Ballard.
Thank you, Mr. Chairman, again. I would like to just comment on what Representative Owens was saying. I believe it works because the University of Kansas, the Med Center, for over 50 years has provided rural preceptorships in Western Kansas. And part of that idea was that the doctors that received their scholarship funding would give 2 to 3 years back as family docs to rural areas. And that has been extremely successful, because what has happened as a result of that, of going out in that area, they have stayed in the area where they did their not residency, their time committed to them as well. And we could do that same thing if we could, because otherwise you don't recruit them. They go back because maybe they came from that area, they want to be with their family, maybe they want to practice in a smaller area. You know, at the same time, we added Wyandotte County as one of those areas that we would do the extra funding for, because a lot of docs don't want to go to that area as well. So I think they could, if we approached it that way, have doctors would go in that area, would practice direct care with our nursing homes, with Osawatomy, with Leonard, and with those other areas. But there has to be a big incentive for them to do it. And for them, the docs was getting their medical payments taken care of. And that program works. We could look at that program and maybe see how we could attract more people to come to that area.
Any further discussion on fiscal year 2023? Seeing none, Chairman Carpenter.
Done? No, thank you very much, committee. I can't tell you how much I appreciate the conversation on this. It's been something that's been dealing with for several years, and you know, sometimes we just have to come to a realization of what's real and what you know, what we need to address to actually make us move off dead center to address the issues. So with that, I move the budget on state institutions for mental health for 22 and 23.
All right, committee, you've heard the motion, seconded by Representative Ballard. All those in favor of the motion say aye. Aye. Opposed? No. The ayes appear to have it. The ayes do have it. Motion passes. Chairman Carpenter.
Okay, next we'll move on to the Institutions for Intellectual Disabilities, Volume 2, page 1197. Okay, the agency requests a revised estimate of $60.5 million, including 23.5 million SGF. This is an increase of 3.1 million above the amount approved by the 2021 legislature. Significant items in the agency's estimate include the following: salary increases associated with executive director. We've had that conversation. 537 and 538. Both hospitals have requested salary increases for its mental health, developmental disability technician positions. In July and August 2021, the governor issued 2 executive directories that effectively increased the starting salaries to approximately $16 an age. In FY 2022, the total cost for these salaries increases was $5.4 million, which the agency was able to cover with excess federal funding and salary savings due to vacancy rates. Contractual nursing staff, including KNI's budget, was an increase in contractual nursing staff. KNI historically reported issues with staff turnover and therefore relies on contractual nursing staff to ensure adequate coverage for the hospital. Due to the COVID-19 panic, the hospital has continued to face staffing issues related to COVID-19 outbreaks, and as a result, it continues to see an uptick in the use of contractual services staff. Total increase in KNI associated with contractual nursing is $1.1 million. However, part of this contractual staffing was covered by federal funds, which allows for the decrease in SGF expenditures of $914,994 in 2022. General increase in supplies include, in Parsons' revised estimate, is several general increases in utilities and general supplies over the hospital operations. According to the hospital, it saw a general increase in the cost of these supplies in 2021 actuals and therefore adjusted its budget request accordingly. The total increase is $513,037, which is primarily covered by federal funds, which allowed for a decrease in SGF expenditures of and $82,726. The revised estimate includes 914.7 FTE positions, which is the same amount as the number approved by the 2021 legislature. The governor recommends 60.5, including 23.5 SGF for expenditures in 2022. This is a decrease of $15,000 SGF, or less than 1%, or 1.1% below the agency's revised estimate. The decrease is due to the governor not recommending Parsons supplemental 15,000 SGF to begin development of the crisis stabilization unit. The recommendation also includes 214 or 914.7 FTE in 2022, which is the same as the agency's revised estimate. The Budget Committee concurred with the governor's estimate for 2022. I'll stand for questions.
All right, thank you, Chairman Carpenter. Committee, are there any questions for Chairman Carpenter in regards to fiscal year 2022? Seeing none, may move on to 2023.
In 2023, the agency requests $61 million, including 31.7 SGF. This is an all funds increase of $472,400 and an SGF increase of $8.2 million above the 2022 revised estimate. Significant items in this estimate include as following: enhancements to continue the salary increases. Both hospitals have submitted executive requests to continue the salary increases associated with the executive directories 537 and 538. The agency found means to cover these expenditures in 2022. KNI utilizes increased federal funds for hospital received due to the COVID-19 pandemic relief funding, while Parsons utilized savings it realized due to increased vacancy rates. Despite finding funds to cover these expenditures in 22, the agency anticipates requiring an SGF increase to their base budget to continue these increases into the future. For 2023, the total cost of these salary increases is $5.5 million SGF. Decreased Title 19 funding, which is Medicaid. In FY 2023, request also includes decreased Title 19 funding, Medicaid funding for both agencies. Due to the COVID-19 panic, the federal Medicaid assistance percentage FMAP rate, which was temporarily increased in the form of relief to allow states to receive more federal funds for Medicaid expenditures. This increase will end at the end of the quarter, which is when the federal COVID-19 public health emergency declaration expires. Currently, the declaration is set to expire in January of 2022, which would continue the increased FMAP until March of 2022. The total decrease is approximately $7.7 million, which is offset in the increase of SGF utilization for 2023. The request includes 927.7 FTEs for 2023, which is an increase of 13 FTE positions above the FY 2020 revised estimate. This is due to the Parsons enhancement request for a behavioral health crisis unit at the hospital. The governor concurred with the agency's request for 2023, and the Budget Committee concurred with the governor's request.
All right, committee, are there any questions for Chairman Carpenter in regards to fiscal year 2023? Representative Sutton.
Thank you, Mr. Chair. Looking at the agency request explanation there, it said that Parsons utilized savings it realized due to an increased vacancy rate. I'm looking at the performance measures for Parsons, and I'm not seeing a tremendous increase in the vacancy rate. Where is it that I should be looking to find that?
Chairman Carpenter.
I'll get back with you on that.
Sure.
Okay.
This is the sort of thing that I think I think we actually double count.
Chairman Carpenter.
That are dually diagnosed. I think we double count.
So on, I think it's that sheet you're looking at there, you'll see the difference between 20 and 21. The staff is dropping 12%. You see that on that line? I'm not looking at the same.
Representative Sutton.
You see where their staff drops 12%?
No, I don't. Well, I do see about a 10% decrease in the total number of new direct support staff hired. So the hiring went down by 10%, but I don't see, does that mean the staff went down?
That means the staff went down by that amount also. So they've reduced their staff, so they've used that money out of that. They haven't done it on purpose, obviously.
Right, well, no. I'm not doubting your word, but that's not what this says.
Okay. Well, I'll have to get back with you on that, but I
Excellent.
will.
Thank you.
Okay.
Thank you, Mr. Chair.
Representative Hoffman.
Thank you, Mr. Chairman. On page 1205, where you have the budget analysis, the other adjustments, I was reading down here, number 3, it's the FMAP, but is that not a one-to-one change, or is there other things in the other adjustments in the SGF? Because it's $7 million or $7.7 million less federal funds coming from FMAP, I assume, but we're only adding $2 million in SGF.
Chairman Carpenter.
Yep, hang on just a minute here. Let me see if I can find that. So what page is that?
1205. It's the figure 10.
Yeah, this is one of those things I always complain about. We get these printed out ahead of time. They don't have the correct numbers on them, and so I mark them up, and I'm too lazy to put the right numbers on them.
Yeah, it would be the fiscal year 2023 analysis figure 10, summary of budget request. It's the one that has the agency request and the governor's recommendation.
Yeah, I just asked about that this morning. Okay, so there's 2 million in SGF, 7 million reduction in FMAP.
Right, and my question was, why is that not a one-to-one? If they decrease it by 7 million on or is there something else in there that's causing that $5 million or $5.6 million difference?
Oh, yeah, it's absent the enhancement request for the crisis stabilization and salary increases. The agency anticipates similar level of spending.
Representative Hoffman.
Okay, so that offsets that 5.6
Right.
million. Okay.
Right.
I just was,
Sorry about that.
No, that's okay. I figured that was a one-to-one, and I was trying to figure that out. So thank you.
I actually have staff make out a complicated one if I can't understand it, but I usually can understand that one.
Representative Rogers.
Thank you, Mr. Chairman. Again, like the last time, I mean, staffing, are we having a hard time getting staffing? I'm assuming just as bad as
Chairman
state
Carpenter.
hospitals?
Yeah, I think it's a little bit better at K&I and Parsons than it is at Osh and Leonard. I think it's a little bit better at those two, but according to the report from the agency, that it's better.
Mr. Chairman.
Representative Rogers.
Because location of where they're located, or
Yeah, I think that's
and
a lot
bigger
of it.
draw
Uh-huh.
where they can get employees.
Yeah,
Because it's kind of, we're pretty much on the same playing field when it comes to dollars for salaries, correct?
we're getting there, I think, very well
Okay.
in this area. So again, that's back to the question about when we have to realize.
So are we, is it a particular you know, is this beginning, are these specialties that we're having a hard time filling, or what, as far as when it comes to like K&I and Parsons?
I don't think it's a specialty. It's
Okay.
mainly the mental health tech is
Right.
pretty much the entry level does a lot, you know, probably 90% of the work are those folks.
Okay, thank you.
Representative Humphreys.
Thank you, Mr. Chairman. Just a quick question. I thought I read that the federal emergency declaration was extended. And so I don't know if you heard if they're going to continue the FMAP same rate, or if that's going to actually change, like we're thinking here.
Yeah, it's actually supposed to end. We hear that it'll end this quarter, which will be the 1st of April.
Even though the emergency declaration I've read has been extended, but they're saying the FMAP increase is going to go away.
Well, that's what we think.
Okay. Yeah, just
But,
something probably to keep
you
an
have
eye
to
on.
budget like it's going to go away. If it doesn't, we'll have extra money in there. But you just, at this point in time, it's up to the feds. And so if it goes away and we don't budget, we're in trouble.
Yeah. Yeah, thank you. Thank you, Mr. Chairman.
Any further discussion on fiscal year 2023? Seeing none, Chairman Carpenter.
Did I finish 2023 too? Oh, good. I'm fine. Very good. I'm off the hot seat a little quicker than I thought it was going to be. Well,
Trying to tell her, don't say nothing.
well, I just wanted to make sure we didn't come back to it later. I would make a motion, we approve the budgets for the state institutions of intellectual disabilities for 22 and 23.
All right, committee, you've heard the motion, seconded by Representative Ballard. All those in favor of the motion say aye.
Aye.
Opposed? Motion passes. Chairman Carpenter?
And committee, I really appreciate, and I've said this once, but I really appreciate conversation on this issue. It's huge. We need all hands on deck for a solution to this problem, and my door is always open for any discussion about this anytime. Thank you.
All right, thank you, Chairman Carpenter. All right, that concludes the budget presentations that we had scheduled for today. And if you looked at the agenda, when we had scheduled the agenda for today, we're actually going to have a briefing on House Bill 2353, which was a bill that we passed out of this committee last year. It was sitting below the line, and then it came back to our committee. There were some changes that needed to be made, and that was establishing the Kansas Commission for the United States Semi-Quincentennial. But we had a new bill introduced. So when we get back from turnaround, we're not going to have the briefing on 2353 today. We're actually going to be having a hearing on 2712, which is the House bill number, which basically does the same thing with the necessary changes when we get back from turnaround. The other thing to notice is that when we get back from turnaround on March 1st, is that correct? March 1st. All right. Tomorrow's February 22nd.
I'm a week ahead of time.
Thank you, Representative Kincannon. We will not be having committee on that Tuesday morning, just kind of depending on what the schedule is going to be like. So you do not have to either come in Monday night or early Tuesday morning, because we do not have any committee meetings scheduled for March 1st. So until March 2nd at 9 a.m., we are adjourned.